getting a patient's belief is the most important part of the therapeutic process. But how do you do that? And how do you do that in life? How do you get people's belief in life? How do you get people's trust? The answer to it is the difference between knowing something and believing something. The difference between knowing something in your head and believing something and embodying it in your soul, in the way you are, in who you are. The classic example is nutrition advice from people that are overweight. Somebody who's overweight and gives nutrition advice, everybody really knows that really, if you want to lose weight, you've got to reduce calories. But actually, if you know that to be true, but you don't do that in your life, do you believe it to be true? Actually, judged on your actions, no, you don't believe it to be true. Once you've got your mindset right, it's easy to do the right thing. But getting your mindset right is the difficult thing. I find this with giving advice to patients. For many years, I was not confident in prescribing exercise advice, and actually getting people to do the right exercises is a really, really important facet of physical medicine. One of the key ways that I've been able to spin this around is that I've always had in my mind that I would never give somebody advice that I would not be prepared to follow myself if I was in their shoes. And so consequently, I never do say to people, why don't you go and ride your bike 3 times a week for a couple of hours, or why don't you run a marathon? Because these are not things that I want to do. If people want to do those things for fun, then that's fine, that's their thing. I will talk to my patients about the importance of strengthening exercises, specifically if they have got an area of their body that is weak, and I believe that they need to strengthen it. I will talk strongly in an embodied way, knowing that if I was in their shoes, I would do those exercises. And I'm very careful to prescribe those exercises in a way that I know I would do as well. And also to try and explain those exercises in a way that hopefully they will understand, that the patient will understand why it is so important. And also to do this with the variability of knowing that I do not have all of the answers all of the time. This is really, really interesting, because actually it's not perfect. Physical medicine is not a perfect science. I cannot guarantee that the exercises I give are going to be exactly the right thing. I'm hopeful, and I believe that they probably are the right thing. If they don't work, then I'm always very clear to people, well, then we will bear that in mind, and we will use that information that we get from the fact that you have applied yourself to those exercises and they have not worked. Then that gives us more information. It tells us, are we barking up the wrong tree? Do we need to look at something else? We can use that information and we can progress your treatment beyond that. I believe strongly in that, and I will use that. And so this helps to make an effective treatment, and it helps to get people better. But you cannot do that if you do not believe. If I do not believe in that as a therapist in the get-go, then you've got nowhere to really go if you haven't got that embodied belief. So I hope that gives you some better perspective in how believing in your exercise, believing in your therapist, and is really important in how I respect the point that you need to believe in me, how I'm not going to dust over issues that you clearly think are important, because that will not help you build the belief that I know we need to make an effective treatment. So yes, my name's Adam Richmond, I'm an osteopath at the Lace Market Clinic, and I don't just work behind your back.